Hey everyone, Todd here, internalarchitect.com. I'm finishing up a post right now about why I believe patients are also experts. Now, there's a lot to my thinking about this, and this is actually something I've thought about for a while. This also has to do with, survivorship and, kind of the lack of attention that the medical industry has given or hasn't given um, survivors as a pretty important resource into really the information that could be used to help further medical um, involvement and to getting to understand kind of the side of the patients a lot more when it comes to the medical teachings of the entire of the entire thing, especially in oncology. And when I was diagnosed with Hodgkin's in 2009, I didn't know anything about this. I didn't know anything about oncology, chemotherapy, just all the treatments. And now that I've been, re-diagnosed 10 years later, I've been through an ungodly amount of different treatments at this point, and I'm able to still talk about it, is really one of the main reasons why I believe that patients are experts. Now, this is also coming from not so much of the schooling that happens with going into medical school, going through nursing school and everything else, but this has to do with like practical experience, like like literally being the one that is in the middle of it. And I think, and I truly believe that because I can tell what the chemotherapy is like. I can tell what it feels like to have a bone marrow biopsy or a liver biopsy. Um, the feelings of the pain and the nausea that comes with chemotherapy, to what it's like to have drug reactions that are unfavorable. Like lately I had to go through a whole bunch of testing to see what I was allergic to, and it turns out it looks like I was allergic to a couple antibiotics, rashes, fevers. All these experiences are super important, and they're really important for the medical industry to hear and learn about. And it's also important to teach the experiences to those that are wanting to get into the medical industry, and for those people that don't necessarily want to go down the Western medicine path of treatment either. Now, as I go further and further down the rabbit hole of the things that I'm learning about, my opinion varies in a lot of different areas, but to be able to say that these experiences that I have aren't important is really, I think I'm starting to feel like it's going to the wayside. And what I feel, in my opinion, about what is going on is really, it's starting to take hold. I truly think, at least in the area where I'm at right now. It's always going to be hard for us as patients to really have the credibility, because we don't have the diplomas and everything else to back up what we learn about all this, right? And with that said, it's the life experience, the actual being the one in the trenches going through the treatments is what really brings us to being an expert in what we're going through. And in my case, cancer. I think that I can offer a lot of light and a lot of help into into what is happening. And it's pretty cool that the place where I'm at is a university also, so there's a lot of students and stuff that come in through here, and I've been able to help explain kind of a different angle to some of the students that have come through, especially during this infusion session I'm in the middle of. Help them understand what certain things are like and how it is, and so that's really the biggest thing to me, and that's what I'm seeing more so of. There's the challenges for us are immense. We're putting our bodies through a lot of stress to try to heal, and it's well known that chemotherapy hasn't been the best way to go about it, and sometimes for a lot of people it can cause even more problems down the road. In fact, there's a lot of studies and a lot of documentation showing that all the different treatments will add to more a higher risk of different cancers down the road. So I understand that going into this, and it's kind of weird. Like I said, there's a lot of different aspects and ways to really engage in a good way, and to also just show that why us survivors and patients are experts at the same time. So that's what I'm thinking. That's what I have going on in my head. And for those survivors out there that are in the middle of their treatment, just remember, to take your experience, and do something good with it, and share your experience with the people that are treating you, so that they can understand at a greater level what it is that you're going through, and to also explain to other people that what you're going through it is possible to beat it. So yeah, that's what I have. That's what I'm thinking. If you have any comments or questions, hit me in the comment section below, and please share, subscribe, do what you do. I really appreciate you helping me get this into the hands of other people that are possibly having a hard time with their cancer or just new diagnosis. And just want to say thank you. I appreciate your time and energy in watching the videos, and I'll see you on the next video.